Good morning, everyone. Another wonderful Tuesday. We are continuing with our series on hair growth restoration, talking about hair loss. August traditionally has been a month when we talk about all hair-related things. And we are going to talk about this morning about a treatment that we've brought on some time ago and have gained quite a bit of expertise in it. I am so happy to welcome back John Stupka. John and I have worked on many different technologies, but I am so proud that over the last several months we have had a lot of experience with SylFirmX, which is microneedling RF. And we've talked about this technology when we introduced the treatment. We focused on face then. Today we're focusing on hair. Good morning, John.
Good morning. Thanks for having me back. I appreciate it. Excited to be here.
So glad you are. So let's talk about Sylfirm, particularly when it comes to hair growth restoration.
What's so unique with this, first of all, in the category of RF microneedling, we don't think about typically hair growth and hair restoration. This is one of the only devices really on the market that Dr. Na invented, who created the whole category of RF microneedling. We're finding that we can use this comfortably on the scalp to create all those little micro perforations that then improves the blood flow. Then when we add, which you'll mention in a second, topical nutrients, we'll say, it's kind of like fertilizer.
Right.
You know, and it's going to get that hair to respond quicker, and patients love it.
Yes, and I'm so excited that our technicians have been working with patients, and the level of comfort from patients is quite incredible, which makes this treatment so attractive. We typically recommend 3 to 4 treatments. They're done more or less on monthly basis when patients come in, see one of our technicians, and then go through a treatment. As John has already mentioned, it's not just the technology itself, but what we add to it. And we've been talking about these magical little vesicles, the exosomes, quite a bit lately. Everybody has probably heard about these really incredible packages of information that feed between cell to cell information and boost and make everything just beautifully respond and grow. So exosomes are typically added in the microneedling process, and we've been very happy with the results.
Yeah, exosomes, you know, that's another unique additive because for someone like myself, everything that comes out of my body is my age. So if I'm able to add something that's a little bit younger source of that communication, I'm probably going to see quicker results.
Right.
And so that's what we like with using this device, because we're improving that blood flow to the scalp. We're improving the condition of the scalp, where guess what? That's where the hair follicle lives, right? And then we're adding those nutrients on top.
Right, and it really has been quite successful. I know that I am proud to say that we are one of the more active accounts in the Southeast, but I know you travel around the country and speak to a lot of different accounts. What's been the response that you've been getting from everyone?
For SylFirmX in general has been fantastic. It's I've been in this industry just a few years. I always say we started when we were 2 years old together.
Right.
And to be able to represent a technology and a device that gets the kind of response and feedback. I had a dermatologist last week tell me, and they have a lot of equipment like you, they said this is his favorite technology that he's ever worked with. So that's nice, not taking anything away from all the other technologies that are out there, but to be able to represent something like that, it's an honor. And it's a lot of fun to go into an office and get the feedback like you and your staff. Dermatology Consultants, this is the place because y'all have done more treatments than probably any place that I work with. So you have probably the most experience of the patient experience and the outcomes, which is nice.
And it's really been terrific. So we are going to now continue on so you can see a live treatment, a patient being treated with SylFirmX microneedling with then exosomes applied. Enjoy, and we are waiting for your comments and questions, and we'll be back after the viewing of the treatment.
All right, everyone. Thank you, Dr. Pare. I'm Cady Holbrook, and this is Anna. We are both estheticians over on our aesthetic end of the practice, where some of our hair restoration treatments take place. So we are here doing a live on Edward, who has kindly donated his body to science today. So we are doing a little hair treatment live, so you guys can kind of see the magic behind the treatment with Sylfirm and our exosomes. And as you can see, he's not screaming. He's not in pain. Edward, what would you say your comfort level is?
Probably a 4.
A 4? Yeah, so maybe a little bit of discomfort. Anna and Kira also worked on me last week, and I would say it's just a little prickle of the needle. Really, really comfortable. So I know a lot of treatments in here can have a lot of discomfort. So it's really nice for us to have something that we can pull from that is not gonna, make you sweat too much about it. So Anna is working diligently on part of our first pass here. So let me talk a little bit about Sylfirm. So Sylfirm, a lot of people know microneedling with RF as used primarily for, skin rejuvenation. Well, fast forward, us at Dermatology Consultants, we are always at the forefront of the newest and greatest things. So we are using Sylfirm in combination with Exosomes to regain hair growth and restore, scalp health. So a few things that Anna is accomplishing in this treatment is three things, okay? The first being, let's rejuvenate the scalp, all right? So just like the skin on the face, we need to rejuvenate the scalp so that we have healthy tissue, okay? Second, we're gonna go through and create maybe some deeper channels in there so we can go in and apply the exosomes and they have somewhere to go. All right. And then our third pass here is going to be delivering those exosomes. Okay. So going in, we're not using any energy for that delivery. And we are just, quite literally pushing the exosomes after applied into the scalp. So we really do have a comprehensive treatment, with Sylfirm for scalp, regeneration. So let's talk a little bit about hair loss, and it can be 1,000 different things going on with hair loss. There's imbalances there, right? Something has gone awry in our scalp, or whether it's genetics or inflammation, all sorts of things like that. So we have to go in, and at the end of the day, we're trying to kind of regain some homeostasis on the scalp so we can make a happier scalp that will make hair like it's supposed to. Us girlies and guys, there's a lot of pressure out there for us to look good, and we want to be self-expressive. So, it's using dry shampoo, it's dyeing our hair, it's styling, it's braiding, it's all these things on the scalp, which can be very, very harsh and throw some things off. So, coming back in and making that skin healthy is really going to help with regenerating. So, and in addition to that, genetics, right? I deal really personally with hair loss, have been for years, and I've thrown the absolute book at it. So it's, I think it's important to take a look at those types of things. Let's take a look at mom and dad, grandma and grandpa. Do I feel like I'm maybe thinning a little bit? I always say in this industry, an ounce of prevention is worth a pound of cure. So it's going to be a lot easier for you to maybe come in, hey, I feel like my hair's thinning a little bit, or hey, like I noticed on my mom, her crown is a little bit thinner. Coming in and recognizing those things and saying, I want to be preventative about it. It's the same thing, with aging intentionally. So really, really important with this treatment. So Anna is going in, and she is kind of on her third pass. So she's going in and making some channels. She's already gone in and done some regenerating with a little bit of RF on the scalp to get that healthy tissue. So we're on kind of our second pass, as you can see, of 3. So we're nearing the end. So you can see kind of how quick this treatment goes. But let's talk about the exosomes really quickly. Exosomes are really fascinating. How I like to explain exosomes is there are these little vesicles. They're acellular. We retrieve them through adipose tissue of a healthy young 20-year-old. So I always like to say they're not creepy, okay? Acellular. And how I like to explain them is they're like little avatars. Everyone's seen the Avatar movie, okay? So these little avatars are taking messages from maybe some of our cells that are depleted, or our cells that are sad, or that maybe aren't working so well anymore, and it's going in and it's jump starting those cells back up again. Okay, so delivering those into the scalp with the needles is important, but if we only just delivered them alone without the needling, you would still see benefit from these exosomes. So imagine we're making channels and then we're delivering it in. So we are really honing in on getting that deep delivery of these exosomes. So again, kind of going back to, you know, the dry shampoo, the genetics, the hair dye, you know, all these things that can really wear and tear on our hair and our scalp. We're going back in and we are trying to kind of rebalance that homeostasis in the scalp for just overall scalp health. Edward, are you still doing okay?
Yeah, doing good.
Awesome. It probably feels good to hear all the wonderful things as you're being treated as well.
Sure.
I'm sure. Anna, so where are we going into now? We're about to...
This is our last pass where we're actually going to put the exosomes into the scalp. So we're going to take the power completely off and just work on working those exosomes into the scalp,
Right.
and the channels that we made.
So what I like to say is we're on the home stretch, okay? So Edward's doing a great job, Anna's doing a great job. She is now going to, of course not with a scary needle, but we are going to use a little syringe just to deliver those exosomes onto the scalp gently. So Kim, I'm going to have you zoom in on our lovely models here. So we have a wonderful mix here of our exosomes, you know, along with some other anti-aging ingredients, you know, such as growth factors, hydrators, you know, CoQ10, all sorts of goodies in there. And you can see maybe just a little light erythema, just a little bit of maybe some pinpoint bleeding, but honestly, Edward has not lifted a finger for work today. So he has a whole day of work and it's gonna probably fade as those exosomes kind of settle in. So this is really something you can come in, you can do before work, you can do at lunch, you know, really, really quick treatment. So let's talk a little bit about, you know, what to expect coming in and maybe even after your treatment. So usually I say just show up as you are, you know, nothing really, you know, needs to be done other than maybe, you know, washing your hair that morning or the night before, mostly just to remove any extra debris that could be in the area. But when you come in, we are gonna maybe mess you up a little bit. So we may do a little bit of, you know, alcohol just to cleanse the skin. And of course we are using a comb to kind of part and diligently get to each of those little areas of concern. You may feel a little burning sensation when you leave. That's just some of the energy that's within the skin. That's all that goodness that we just did. But the nature of exosomes is they are going to help a little bit with the inflammation cascade. So if you are holding a little bit of pink, which we actually really want to see in the scalp, you know, those exosomes are actually going to help, you know, quicken that downtime with the pink along the scalp. So usually by the time somebody is back to work or to car pickup with kids, you know, that redness or pinkness is already starting to subside. Now let's talk a little bit about what Edward can expect when he goes home tonight. We usually like for him just to leave things alone. So, you know, maybe let's not shower or rinse anything. Let's reserve washing hair for about 24 hours post or like the next morning. Same with hair care products, because remember, we just made a lot of channels and the only thing we really want in there is those exosomes. So, you know, washing hair the next day after 24 hours is totally fine and styling as normal. So really this treatment is not disruptive at all to anyone's lifestyle or social calendar or things like that, okay? And then, you know, frequency, right? So, you know, we would love for people to come in about 3 to 4 times. And then some sort of upkeep. You know, we preach this all the time with skincare. It's you don't just go to the gym and get abs and then quit going, right? So we do have to kind of upkeep, because sometimes at the end of the day, you know, if it is something genetic or we are, you know, battling some sort of hair loss condition, you know, we want to kind of stay on top of it. So, you know, Edward this is his first treatment, so we would likely see him back in about 4 to 6 weeks, and then so on, you know, 2, maybe 3 more times. And then upkeep can look like every 6 months, maybe every 3 months. We're going to figure out that cadence with you based off of, you know, what you have going on that day. Looking good. We're nearing the end. Edward, what are you feeling right now, like in terms of sensation?
It feels good. I mean, it's not bad at all. Just a little bit of tingling.
Yeah.
But nothing crazy.
Yeah, your mental headspace is good too.
Right.
Okay.
Yes.
We try not to torture you.
I don't know about my mental health.
Wonderful. Well, we're nearing the end here. And then, reach out to us. You saw how quick this treatment was. And if you have questions, we all are very passionate about hair in here. We always laugh. We always make the joke. We're trying to take hair off in one room and put it back in another here in Derm. So here we are trying to put it back. But yeah, reach out to us. We do consultations for free here at Dermatology Consultants. We have so many modalities as well to help with hair, whether it's supplements at home, topicals at home, treatments, PRP, exosomes. With hair loss, sometimes it is, throwing the book at it and seeing what kind of sticks. But, we've got a really good one here with this exosome treatment. We're really, really happy to offer it to you all. Thank you so much, Edward and Anna, and Dr. Pare, we'll kick it back to you.
I hope you enjoyed watching the treatment. You can tell that the patient was very comfortable. And as I've already mentioned, typically it's a series of 3 to 4 treatments, more or less on a monthly basis. And then once the original treatment series is complete, we recommend kind of a reboost, depending on the patient, depending on the goals, every 3 to 6 months. Let's talk about the selection of patients, because I think that that's really important. Clearly, a male patient, very successful in the treatment, but our practices, and that's what makes dermatology so amazing, are so diverse, different ages, both female and male, different ethnic backgrounds. So John, what are you finding across the nation? Who are the great candidates for the treatment?
I think that's a great question. A lot of times when we look in the mirror and we notice our hair thinning, the statistics show that can be close to a 50% once we start to notice it. So what we're seeing is that patients are starting to look at this from a preventative standpoint. The number one cause for hair loss is genetics, androgenetic alopecia. So if we look at our parents and look at our grandparents and look at what their hair looks like, we're gonna probably know that we may see some thinning. So if we can get started earlier from a preventative standpoint, and SylFirmX is such a great way to do that because it's such a comfortable experience for the patient. So the earlier the better, I think.
Right, so prevention certainly very important. We have been talking about what's called senescent telogen effluvium. We've had so many patients that have been affected by COVID, so I do see a lot of women in my practice. They have benefited tremendously as part of that hair growth regenerative approach from Sylfirm microneedling. I think that has worked very well.
Yeah, to your point, women respond really well to this treatment.
Right,
really
and then
well.
I've always said I'm so proud to have such a diverse patient population. Traction alopecia in African American female patients has been fantastic to treat with this tool as well. So come explore with us. We are still in the month of August. You still have the opportunity to get a consult, to take advantage of our 15% off of the treatments. And I hope you enjoyed this presentation. We are waiting for your questions. Have a wonderful Tuesday. John, thank you so much for joining me this morning.
Thank you, Dr. Pare. Enjoyed it.